The following program is sponsored by the Medicine Center Pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacies. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices, and our guest is Joey Romar, DO, with Aultman, Orrville, Dunlap family practices. Good morning, Joey, and welcome to the show.
Thank you, Paul.
All right. Today we're going to be discussing cold, flu, and COVID season, all timely topics around the holidays here. And we want to remind our listeners, too, that our program is available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
Thank you so much, Fred. My name is Dr. Joey Romar, and I work at Aultman Orrville Dunlap Family Practice. And I've been there since 2019, and I did residency at Aultman Canton, so I actually drove by the Medicine Center Pharmacy every day.
Okay. Tell us a little bit more about yourself and your career with Aultman.
Yeah, so I went into family practice because I wanted to help patients of all ages in the outpatient setting and really focus on the education part and the preventative medicine part. So yeah, that's how I ended up here.
Did you go to Ohio University or where did you go first?
Yes, I went to Ohio University Heritage College of Osteopathic Medicine. When I was in college, I shadowed a DO doctor and he popped a rib back into place for a patient in the ER at 2 a.m. And I was like, I want to do that. So I do the osteopathic manipulation part and the medicine part.
Okay, my daughter went there and that college is pretty social and an awful lot of
So it's sort of known as a party school, but unfortunately in med school, I didn't have time to do all that.
Yeah, okay. That was a nice campus.
It's beautiful, yeah.
Yeah. So what kinds of patients do family medicine doctors see?
Yeah, great question. So I call it actually birth to death. So all the way from newborn babies up to 100-plus-year-olds, and we treat them in the outpatient setting, so in the office.
You know, I'll back up a few minutes here. Did you go to see the mental institution at that?
I did, yes, very
Gosh.
powerful. Yep.
How interesting. My gosh. I couldn't believe with all the stones in the back behind that building and that people would send their children there or whatever
Yep.
just because they thought they were I don't know what, you know.
Yes, a lot of history there.
Very interesting. Gosh.
All right. Well, let's get into the thick of things and talk a little bit about what's going on here this season. How about we talk about upper respiratory infections first, and what is it?
Yeah, so upper respiratory infections are any infections that are sort of the upper part of the airway. So your nose, your throat, your larynx, so colds, runny nose, that kind of thing.
All right. So what are some common causes of upper respiratory infections?
So colds are the most common upper respiratory infection. Those are usually caused by viruses. Flu and COVID can also cause upper respiratory infections. And then strep throat, sinus infections, those can also be considered upper respiratory infections. Strep throat, of course, is a bacteria. Most sinus infections are viral, but they can also be from bacterial causes.
Can you talk a little bit more about differences between strep, colds, and flu? I mean, I feel like even to this day, I don't think that, I don't mean it to be negative, but I don't think the general population understands the difference, honestly, between influenza and, the stomach flu and, the different things.
Yep.
So can you give us some pointers to try to make it simple?
Absolutely, yes. So colds are what's most commonly known when you get sick with like a runny nose, a sore throat, your ears might hurt, you might have some pressure in your face. Those are mostly caused by viruses, rhinovirus. There's many different viruses. We often don't test for these because there's not a whole lot of treatment besides supportive care. Now, flu and COVID can cause upper respiratory infections, so they can cause cold-type symptoms and be a mild illness. What's different about flu and COVID and sometimes RSV is they can also cause lower infections like pneumonia or become more serious. And then strep is a bacteria that likes to primarily cause sore throat. And strep, we always want to treat with antibiotics. Antibiotics don't work for viruses. So even though it might feel like, oh, I have a sore throat, I need an antibiotic, often you don't because almost all of colds and certainly flu and COVID are all viral, and antibiotics don't work for viruses.
So, okay, what is the best way to prevent flu and COVID and RSV?
That's a great question. Well, the best offense is a good defense. So vaccines are going to be your best way to prevent these infections. Viruses are hard to treat. They're tiny. They like to hide in cells a lot of the times. There aren't a lot of good treatments for it as far as like antibiotics help bacteria. So vaccines take a small amount of dead or inactive virus. They put it in your arm. Your immune system forms antibodies against them, but you don't get sick because it doesn't take over your whole body the way actually getting the illness would. So the CDC recommends flu shot and COVID shots for anyone 6 months and older. RSV vaccines are available for infants who are at higher risk, and then all adults 75 and up. And they recently said 50 and up can get the RSV vaccine as well if you have certain medical conditions like diabetes, asthma, heart disease. So you definitely want to talk to your doctor about vaccines because they're our best preventative measure for a lot of these upper respiratory infections.
When should a person seek treatment if they have URI symptoms?
Yeah, so usually sore throat, I recommend people call their doctor. Only because if it is strep, then you need an antibiotic. If you don't treat strep, rarely you can have long-term heart or kidney problems. So usually sore throat, I like to see my patients. Many offices have rapid testing like ours does. We have rapid flu, rapid strep testing, so we can do it right there and we can find out right away what you have. And that can be helpful with the diagnosis. It's never a bad idea to call your office if you're not feeling well, and they can give you instructions or kind of help you determine if you need to be seen or not. Certainly, there are more serious symptoms that should be seen right away. High fever, trouble breathing, chest pain, confusion. Some of those might be more either call your doctor or go to the emergency department. I think we're going to talk about that later too. So.
Okay, so when should a person go to the regular doctor versus the
we're going to talk about that
ER,
right now.
the ER for their symptoms?
Yes, so I would say cough, runny nose, sore throat, drainage, ear pain. Those are all things we can easily see in the office. And usually your doctor, can get you in fairly quickly. Certainly if your doctor can't get you in, urgent care is also appropriate for those types of symptoms. The ER you want to go for more serious symptoms. So that would be like chest pain, trouble breathing. If you can't wake someone up, like if they're pretty, we call it somnolence, but pretty sleepy, or if someone's confused and not acting like themselves, those are all kind of our red flag symptoms. But again, you can always call your doctor's office and talk to their on-call nurse and get advice on where to go.
There's all kinds of over-the-counter products that really do help
Mhm.
keep you away from the physician, doctor, whatever. And it as a pharmacist and over the years, it just was a constant. Oh, I'm this sick. I got this. I have that. I need an antibiotic. I need where should I go to get that? And can I gargle with what something salt water? I don't know. Anything along the line. So it really is. It was. No, I don't really practice pharmacy that much anymore, but it really. I'm sure it's the same. In the stores.
Yes.
Everybody wants an antibiotic. Okay.
Yes. So yeah, and actually we kind of overprescribed a little bit in the last 20 years, and we are seeing resistance patterns with
Yeah.
certain antibiotics, and we don't have that many new antibiotics coming out, so we have to be really careful that we only prescribe antibiotics when we truly suspect it's a bacteria. And I don't think a lot of people realize most coughs and colds are viral and are just going to go away on their own. But there are medicines, both over the counter and prescriptions, that can make you feel better in the meantime. So using your physician resource, using your pharmacy resource is really important instead of just automatically going to the antibiotics. And antibiotics are not benign. They can have side effects. A lot of times they will cause diarrhea because they kill off the good bacteria in your gut. You can have an allergic reaction to them. They can be very serious. So antibiotics are not, side effect free or perfectly safe. So that's kind of why we don't just automatically throw an antibiotic at any little cough or cold, especially if we suspect it's viral, because it won't work anyway.
Okay, doctor, it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in and schedule your pneumonia, Tdap, or shingles vaccine online at midshoprx.com.
Okay, before the break, you gave us some coaching on when to go see urgent care versus calling your regular doctor, or maybe, hopefully, you don't have to head to the ER, but sometimes those things happen. One thing I hear in the pharmacy a lot, which I'd hope you could touch on, is how important it is for a patient to have a regular primary care physician. We have a lot of people that come in like, I don't have a doctor. I just go to the urgent care. And how do you feel about that?
Yeah, that's a great question. So you really can't beat having a doctor that understands you, might know your family, knows your medical background, knows your questions or concerns, and they're also available to you. Urgent care is good for quick, sort of minor health issues, but they're really not going to deep dive into preventative care, preventing these illnesses, preventing long-term health problems. They're not going to check regular blood work. They're not going to kind of provide that full service treatment that your primary care doctor does. Also, if you see specialists, your primary care doctor is kind of like the quarterback. So we receive all those records. We make sure everyone's on the same page. So that can be very valuable. And also, a lot of referrals and testing can be discussed with your regular doctor. So, I mean, certainly I'm biased, but I think it's really important.
Well, I appreciate you commenting on that. It's just I agree with all that, and I feel like it's no different than when someone comes in the pharmacy and they want some feedback on, I had this before, and you can look at my file and you can see all the records. And I feel like even with our advances in technology, it's still the human part matters still. So
Absolutely. Yeah. And developing that relationship, that trust between the doctor and the patient can be really important and can help make you feel more comfortable as a patient, sharing a lot of your medical needs and concerns, which can be a deeply personal thing. And having someone that can spend, you know, 30 minutes with you, sitting down, talking with you about a problem instead of sort of rushing in and out. That we do see with some of the urgent cares. I do find that valuable, even though urgent cares, of course, provide a service as well. But you can't beat that doctor that knows you and can help you on a personal level.
So also before our first break, we talked a little bit about antibiotics and how a lot of people think that you have to have that to cure your situation. Can you talk about treatment options available for viruses, and what we're going to do about that for patients who need treatment?
Absolutely. So a lot of the cold viruses like rhinovirus, those type of upper respiratory infections, there aren't antivirals that are FDA approved for those. Now, flu has a antiviral medicine called Tamiflu. It's not like antibiotics, though. You don't have to have it in order to get better. What it does is it shortens how long you're sick. And antivirals are usually most effective when the virus is multiplying like crazy in your body. So they're best really early on in the illness. So Tamiflu, for example, is best within the first 48 hours of you getting sick. So another reason to kind of call your doctor when you start to get sick in case it is flu. That medicine is most effective right in the beginning of the illness. Same thing, there are several COVID medicines, again, that can kind of shorten how long you're sick. Those are best within 5 days of your symptoms. But again, they're not necessary to get better the way antibiotics are for like strep, for example, but they can help make you feel better quicker. But remember, a lot of viruses just go away on their own. So it's mostly about getting treatments to help with your symptoms and make you feel better.
Interesting.
All right. Well, I guess we'd be remiss if we didn't talk about treatment options for bacteria and bacterial infections.
Yeah, absolutely. So antibiotics are medications that treat bacteria. So for example, strep throat, you always want to treat that with antibiotics, like I said earlier, just to avoid some of those rare but serious long-term side effects. So penicillins are still the mainstay of treatment for strep, and then there are other antibiotics if you're penicillin allergic, of course. And I've called many a pharmacist to help me, especially with the pediatric medication dosing and all that kind of stuff. So it's really a team effort, but yeah, bacteria do sometimes need, and usually when you hit that 10 to 14 day mark where you're really not feeling better, that's usually a sign of, okay, maybe this isn't a virus that's going to go in its own. Maybe I need to talk to my doctor and see if an antibiotic is appropriate.
Okay. How about some side effects to antivirals or antibiotics? Anything you want to touch on or educate on those?
Yeah, absolutely. We talked about often antibiotics can cause diarrhea because they kind of kill off those healthy bacteria in the gut. You can obviously have an allergic reaction to antivirals and antibiotics that can be very serious. So we say swelling of the lips or mouth or trouble breathing, obviously call 911. Or if you break out in a rash, definitely call your primary care doctor or urgent care there is there if you need that, if you're having an allergic reaction. So that's why these aren't benign medications. That's why we don't just hand them out, kind of willy-nilly. So that's why you really want to be examined and treated appropriately and not just kind of treated without being evaluated.
What can people do at home if they have an upper respiratory infection?
Yeah, absolutely. Of course, I recommend, calling your doctor for medication instructions, but there are some things you can do at home. Chicken noodle soup, believe it or not, they did a study and you do feel better.
Oh, come
um,
on.
no, there is. I'll send it to you. So something about the hot liquids helping with the drainage and that kind of stuff. Um, Honey is a natural cough suppressant. Now remember, honey's not safe for very young children, but for adults, it can help be a natural cough suppressant. So I tell my patients some hot tea with a squeeze of lemon and a little bit of honey can help soothe the throat and help with cough. Of course, you always want to drink plenty of fluids when you're sick because you tend to you can get dehydrated because your body's fighting off that infection. Now, remember, certain patients with certain medical conditions like heart or kidney problems may have a limit to how much fluids they should have to avoid doing too much. So again, that's something your doctor can kind of recommend for you. But in general, staying hydrated is important. Gargling with salt water can really help with sore throat, just to help with the drainage there. And then if you're feeling particularly dry, humidifier in your home can help as well.
Yeah, right. So, should people take over-the-counter medications for their symptoms?
There are many wonderful over-the-counter medications that are safe and can make you feel better. It's very individualized, though, so it depends on your medical history. Sometimes it's your weight for dosing purposes. There are side effects to a lot of over-the-counter. Just because the medicine's over-the-counter doesn't mean it doesn't have side effects. So again, you want to use your doctor, you want to use your pharmacist resources for that. Again, I'm not going to make any kind of general recommendations just because it is so individual. What I do run into with my patients is often they will take more than one over-the-counter medicine, and you have to be careful. I have had patients who accidentally overdose because the same ingredient is in multiple kind of cough and cold and flu medications that are over the counter. So you want to be really careful with that and always talk to your doctor or your pharmacist about what you're taking.
Right. So, I guess we kind of answered this next question. Are there side effects to over-the-counter cold medications?
Yes. So like we talked about the accidental overdose, you want to be careful of that. The other thing is a lot of the kind of naturopathic and vitamin stuff, you want to make sure that they're well researched and there's efficacy. A lot of those aren't FDA regulated, so and a lot of them don't have a lot of good research on it. So a lot of claims, you got to be careful with what you're taking. So again, using those resources and kind of jumping into the next question with the kids, the therapeutic level for children is very close to the toxic level for children. So there's not a lot of over-the-counter meds besides Tylenol and ibuprofen that are recommended for children because they're smaller, their metabolism is different. So you, again, talking to your doctor about that. And even Tylenol and ibuprofen aren't right for some pediatric patients. So you just want to make sure you check on those.
We as pharmacists do hear about all kinds of this and that fixes this and that, and
Yeah.
I chew on a log or something like that. It's just some of the stuff is just absolutely amazing.
Yeah. People trying to sell stuff on the internet, a lot of times they get a lot of
Yeah.
questions. So you got to be careful.
I've been a pharmacist for a long time, and over the years, it's just some of the stuff that has come before me. I'm thinking, oh my gosh, yeah, are you really? We had an English couple that lived beside us for quite a few years, and with them came cottage catarrh and just all kinds of stuff that they and first thing when they got sick, they said, well, where do we get the malt and milk? I said, well, yeah, at the ice cream store, I guess.
Yeah, right.
Well, don't you sell it for medication and for cure and whatever, And I just it was very interesting. And they had a lot of homeopathic stuff that they, used in England.
Yeah, and there's some homeopathic stuff that does have research in that is okay, but a lot of
Mhm.
it is marketing, and you want to be careful. I think the latest is my patients were rubbing beef tallow on themselves, I think. So I was like, I don't know what the hell helped.
Oh my God.
Uh,
Okay. Well, Vicks on your chest, and I remember Mama years and years and years ago put it all over your chest and put a towel on it,
yeah,
over your nose and sniffing that and all that kind of stuff.
right.
Okay. It is the time. I'm sorry. It's the bottom of the hour time for the news. Thanks for
hmm
joining us this morning on Health Matters, the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we are talking with Dr. Joey Romar.
I
All
want
right,
one of
let
those Christmas wreaths.
How many you want? We got a ton of them. We do. We
all
have
right,
the.
well, let's talk a little bit more about kids. One of the hard things
hmm
in the pharmacy is, I'm old now. So, I have a 20-something-year-old child, and
hmm
medicating your child over the counter was a lot different 20 years ago than it is today.
hmm
And it's interesting what the guidelines have changed. And you mentioned earlier that you got to be careful with different medications, because I'll throw a stone. You can walk into a Walmart and see 25 feet of cough and cold, and there's really only like 4 ingredients in any box on that whole wall. So
Right,
you
sure.
gotta know what you're doing. But that being said, when you have a young child and you're trying to get the kid to sleep through the night, and you are too, it's not as easy to treat as it used to be. So can you talk a little bit about how to help, especially younger infants and children, when they've got these sinus congestions and coughs and drainage, and they're not comfortable, and they're trying to get them through the night, but you can't give them antihistamines anymore, and you can't do decongestants anymore. So what do you do?
Yeah, yes, yes. It can be very scary as a parent, and you just want to help your child for sure. But yeah, the American Academy of Pediatrics is really exercising caution with a lot of over-the-counter ingredients. So we touched on, of course, Tylenol and ibuprofen, if appropriate, if okay with your doctor, if there's no contraindication. So for example, it can depend on the illness. So like croup, when you have that croupy cough, actually cool air, believe it or not. A lot of times kids will have that kind of awful cough. And as they're taking them out to the doctor, as they're out in the cold air, it kind of helps a little bit. So um,
Hmm.
also with infants, you want to do nasal saline and a suction bulb. So a couple drops of over-the-counter saline in the nose, and you can suction that out with the suction bulb. They hate it, but it does help clear out their airway. And babies and young children breathe primarily through their nose, and so that can be very helpful. the warm shower with kind of the humidified, and a cool mist humidifier as well can help kind of clear out some of that drainage. And then uh, honey can be safe, but not for very, very young children. But for older children, a little bit of honey can help with cough. And if they can do gargling salt water for older children and teenagers, that will help with sore throat as well. Letting them rest, keeping them, home from school if appropriate. Because kids, again, they'll get better. It's just trying to make them feel better in the meantime.
Mama used to use nose drops on you. 1/4% neosynephrine nose drops.
Oh boy.
Well, they worked, and adults to this day, there are about 95% of adults that will not use a nasal spray
Yeah,
or a decongestant or whatever.
sure.
I've used them for years. I don't want to take that junk inside,
Right.
drink and
Yeah. Nasal
drink
sprays
off.
can be great, especially for adults.
Yeah.
But again, yeah, you just gotta be careful with the kids because they absorb so much differently.
Yeah. Okay. Okay.
So, are there any over-the-counter tests available to determine the cause of an upper respiratory infection?
Yes, it's actually pretty cool. One of the few positive things that came out of COVID is we do have COVID and flu tests that are over the counter at many pharmacies. That can be helpful if you call into your doctor and you say, "Hey, I tested positive for flu. What should I do?" Or, "I'm negative for flu and COVID. Do I need to come in for other testing?" So that can be very helpful now that those are available over the counter to purchase on your own.
All right, I got a couple loaded questions here for you.
I know. I was nervous having a pharmacist ask me these.
Well, I'm sure we're in agreement.
Yeah.
Is it okay to take someone else's medications for
No, it
your
is
own
not.
symptoms?
No, 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 no. So I see this fairly frequently. I'm sure you guys too. But so we're all individuals, right? So we all have different medical histories, different weights, different metabolisms. So it's not safe to take other people's medications, and it can actually be quite dangerous. And you're also taking that person's medication away from them as well. So we do not recommend taking other people's medications. And that probably leads into our next question. uh, um,
Yeah, so touch on expired medications. I mean,
yeah,
I have a
so
theory, but I'm sure you do too. So,
yeah, it's a struggle, right? So you feel sick, you're like, so first off, when you have old medication, especially antibiotics, the directions are to take it to completion. Okay, so a lot of people stop when they're feeling better, but you really want to take that full course that your doctor recommends and that the pharmacy gives you. If you stop too soon, sometimes there's a couple few remaining bacteria, and that can lead to resistance rates because those few bacteria can mutate. And also you might not be fully treated. So then we run into later on, oh, I'm feeling kind of sick. Let me just take this old antibiotic that I have. So they can lose potency over time. That's why there is an expiration date. So it might not be, number one, appropriate for what you have, and number two, it might not be effective anymore. And again, you're increasing that risk for resistance. And then you also don't know over time. We know a little bit about what happens to these medications, but heaven forbid, that they form a weird metabolite or some sort of toxic side effect because they've been sitting in your cupboard for 10 years. We don't really know, what happens over time. So it can be dangerous in that respect too. So do not recommend.
well,
I've heard many times at the pharmacy counter over the years, Mrs. Jones coming in and oh, my blood pressure medicine's not working so good. And Mrs. Smith beside her says, "Well, here, take some of mine." And
No.
you try some of mine, and I think, "Oh my God, come on!"
Oh, that can be very dangerous.
Yeah, for sure.
well, since most people have Tylenol or acetaminophen in their medicine first aid kits or whatever medicine chest at home, I do want to touch on that medication is a big problem if you take it expired. So don't just think we're trying to get you to buy a new bottle. You know, Tylenol especially is a problem. It might be one thing if you use your year-old A&D ointment on a scrape or something, okay, but don't mess around with oral stuff. So
Yeah, it's not worth it. And I recommend getting rid of old medication. We have powder that we can give to patients so they can safely dispose of it. And I'm sure you guys have, recommendations for patients as far as getting rid of old medication. But yeah, it's not safe.
Yeah, and flushing your medication is not ideal. Do not do that.
No, nope. We don't want
So,
those chemicals in the water.
yep.
Um, hmm. What can people do to prevent the spread of various infections? These infections, stay away from
Yeah.
close, whatever.
So if you're sick, you are infectious for at least part of your illness. Okay, so it can be important to help prevent spread to other people. So good hand washing is with soap and water is really important. If you don't have access to soap and water, hand sanitizer can be helpful as well for many of these viruses and bacteria. Um, if you've seen that picture where they captured like the sneeze and all the air droplets coming from it or the cough. So staying away from other people does help prevent them from getting sick because it gets spread through the air. Similarly, wearing a mask to help and covering your mouth when you cough can be helpful to help prevent the spread. Um, Typically, you're most infectious at the beginning of the illness. Um, so I think we touch on this later too, but usually I say it depends on the illness, but you want to be either 24 hours on antibiotics if it's a bacteria, or um, you want to be 24 hours fever free with a lot of the viruses and your symptoms getting better before you really probably aren't as infectious as you are in the beginning of the illness. But we really encourage people to um, try to help prevent the spread. It's hard though with
Yeah.
schools and different things. It's hard to prevent it, but we should make the effort.
How can people prevent their loved ones from getting sick? Push them in the other room of the house or what?
Yeah, I mean, it can be hard, especially when you live with someone else. But kind of like what we just talked about. Also, remember to protect your loved ones. Getting those vaccines can be critical. So you might only get a mild cold if you get the flu or COVID or something, but your loved ones, especially those that are at higher risk for more serious complications of those illnesses. So that would be the extremely young, the extremely old, and the immunocompromised. So, for example, family members that are fighting cancer, or other on medications that lower their immune system, they're particularly susceptible. So getting vaccines, staying away when you're sick, and that kind of thing can really help prevent more serious side effects from these infections.
Break time, Brad, maybe? Okay. Okay. And it's time for our final break, and you're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thank you for joining us, and we are having a very great conversation this morning with Dr. Joey Romar. So, doctor, when should someone with symptoms of an upper respiratory infection stay home from work or school?
Yes, so like we touched on before, usually 24 hours fever free off fever reducing medications and your symptoms getting better. Strep in particular, we you to be 24 hours on antibiotics. So often that will require the child to stay out of school, and usually we provide a school note, of course. And that can just help prevent the spread of these infections.
All
Um,
right. Oh, go ahead.
I always go back to work when I feel grubby. So
Uh,
I don't like staying home, but whatever. I guess I'm a bad example.
Well, a lot of jobs offer homework or telehealth or different options to work from home. So, and each employer might have different restrictions as well. So, it's a good idea to check with your HR as well.
Okay.
So, what tips do you have for people once they start to feel better? How should they behave, or what next steps should they consider taking?
Yeah, absolutely. Actually, Brad, I watched your YouTube short and got some additional tips as well. But so to boost your immune system in the future to help prevent getting sick in the future, besides vaccines, you want to get plenty of sleep. You want to eat healthy. fruits, vegetables, lean meats. You want to make sure you're drinking enough water, understanding that you're, depending on your medical conditions, there might be a limit to that as well. Exercising can help boost the immune system. Good hand washing can help prevent you from getting sick in the future. Another big one that we haven't talked about yet is avoiding smoking and vaping and heavy alcohol use. All of those can lower the immune system, make you more susceptible to URIs in the future. And so just kind of maintaining those healthy habits can decrease your chance of getting sick and getting loved ones sick in the future.
Do you treat children, younger, or is it
Yep.
mostly adults?
All the way from usually we get them at 3 days old. At Aultman Hospital here in Orrville, they deliver babies and all that kind of stuff. So we see a lot of new babies from there. And so, yeah, we treat all ages.
All right, we've
Okay.
covered a lot of ground today so far, but I
Mm.
want to just kind of get the pulse of what you're seeing. I know what we see in the pharmacy, but so in your practice, you're clearly seeing a lot of upper respiratory infections and COVID. Are you seeing a lot of flu yet? Which type of flu are you seeing? And what's floating around there that people should be aware of as we get really close to the Christmas and Hanukkah holiday seasons?
That's a great question. So right now I'm seeing mostly COVID. I'm seeing a couple strep, a couple ear infections, but mostly COVID right now. And the symptoms vary widely. So I always encourage my patients to talk to me about testing because they're like, well, I had COVID in the past and it didn't feel like this. The virus unfortunately mutates. That's why you can get it more than once. So it's kind of a tricky virus. So flu hasn't hit us locally in this community yet. We're all kind of waiting with bated breath. The CDC predicted that it was going to be a bad flu year this year, similar to last year. So that's why we're really trying to push the flu vaccine now before it has hit yet. So we actually haven't had a, knock on wood, we haven't had a case yet in our office, but we're sort of prepping ourselves for when it does hit. Typically, flu is worse late December and most of January. So that's why we recommend getting vaccines now. Peak vaccine efficacy is usually about that 3-month mark. So we're trying to hit everybody up. And again, it's those vulnerable populations that typically can do really poorly with flu, which is why even if you're like, oh, I'm young and healthy, I don't need, the vaccine. It can help protect, people that can get sick very quickly and get where it turns into pneumonia or a more serious infection. So we're all kind of waiting with bated breath. Usually flu season is pretty busy. I'm sure it's busy for you guys as well.
Can you talk about, there's an awful lot of vaccine hesitancy now, and I don't want to get political about it, but can you just give some tips on, I just can't see why it isn't a good reason to get a flu shot. But do you have some comments for you want to
Absolutely.
break some myths of what you
Sure,
see
yeah.
and whatever data you have off the top of your head to support
Absolutely. Yeah, so it can be very confusing for patients. I don't blame them for having questions. You often get a lot of different resources and social media, influences, political influences that can be very confusing. So, and my information is based on the American Academy of Family Practice and sort of my research in as far as what my governing bodies recommend. So vaccines are safe and effective. Just like any medicine, vaccines can have side effects. They are extremely rare. It is much more likely that you're going to have a bad outcome or even a fatal outcome with the illness we're trying to vaccinate than it is to have a vaccine side effect. But it's not zero, so that's something you want to talk to your doctor about. The other myth I run into a lot is, oh, I got the flu shot once and I got sick. So it's just bits of dead or inactive virus, so it can't take over your body. It just stimulates those immune systems in your arms, so it can't make you sick. I think what happens is you might have a sore arm, you might feel achy for a day or two because your immune system is turned on. Your immune system's like, oh, we're getting attacked, even though they're not getting attacked. So you might have a mild reaction like that. The other thing is you're usually getting your vaccine in the office at a time when it's respiratory season. So you might come to my office, and unfortunately, there's a lot of sick people here. You might pick up a cold. That's not the flu. The flu typically is a bit more severe symptoms, usually fever. Usually you feel exhausted, joint pain. Usually it's a bit more of a severe upper respiratory than just like a cough or a cold. So if you got kind of a runny nose after you got the flu shot, Did you get the flu from the flu shot? Probably not. You probably picked up something while you were in the waiting room, or got it's this time of year for coughs and colds. So that's another big one I see. Just remember that my goal is your health. So I'm not financially benefiting from, arguing with you about vaccines. I just want you to be as happy and as healthy as I can. So that's why I do see phenomenal benefits in preventative medicines. An ounce of prevention is worth a pound of cure. I would much rather give you a vaccine and talk about that than try to help you through where you can't get off the couch because you're so sick, or you, heaven forbid, have to end up in the hospital. So that's some of the conversation I have, and I'm always happy to answer questions with patients, and it's your body and you have autonomy over that. But I'm going to give advice that I think is best for you, and that does include vaccines.
Any other tips you want to share with the public? We've got a couple minutes, but you want to wrap up in summary what we talked about today, or what you think the public needs to know the most to get through a healthy and happy holiday season?
Yeah, absolutely. So family medicine, like I said, I take care of the whole family. So I like to make sure everyone stays happy and healthy throughout this respiratory season. Unfortunately, this is a season where a lot of people are sick and aren't feeling well. And it's the holidays, you're around lots of other people. A lot of travel can put you at risk for some of these upper respiratory infections. So again, I just encourage everyone to talk to their doctor, talk to their pharmacist to help them feel better in a safe manner, just because I don't want people to get hurt by doing the wrong thing. So that's pretty much my spiel today.
Well, we really enjoyed talking to you. We'd love to
Yeah,
have
I'm so happy to be here.
love to have you back again.
Oh yeah, absolutely,
Yeah,
absolutely.
it's we've been on the air for over 15 years, and we've talked to a lot of doctors and a lot of nurses and a lot of health professionals. I've learned so much, and it's interesting as I'm walking around, traveling around people. Oh, who's your guest this week? I want to make sure I listen.
Aw.
That sort of thing, and the patient base out there, and just about everybody is really wanting to know about healthcare and not have to go read a book, that sort of thing.
Yes.
And that's how our program has really helped a lot of people, with all of the specialists and individuals like yourself that are on. Are you still taking new patients?
Yes, Aultman, Orrville, Dunlap Family Practice is taking new patients. So our phone number is 330-684-2015. So yeah, just give us a call. I am proud of all of our nurse practitioners and doctors. I think we have a great team over here. We love our patients. This rural population really does special to us. So yeah.
Okay.
And my mom was very excited that I was going on the show, by the way.
Oh, that's fun. That's
Yep.
because she paid for your college and your education.
Oh yeah, well,
and
yes.
she's proud of her daughter.
Yes,
For
yes,
sure.
she's
Very
listened to me a
proud.
lot.
Okay. Thank you to our guest, Dr. Joey Romar. If you
Thank you.
suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you next week, Friday, here on Newstalk 1480 WHBC. And thank you again very much, Doctor.
Thank you.
We enjoyed listening to you.
Love talking to you.
Yes,
The
thank you very much.
preceding program is sponsored by the
Take
Medicine
care.
Center Pharmacies.
All right, I get rid of them. So,
Yep.
I'm stressed.
well, thanks.
How'd I do?
You did fabulous. So,
I'm
thank you very
sweating.
much.
Yep.
Thank
Have a
you
good
for
day.
having me. This was
Nice.
so fun.
Yes.
I would love to come back. I mean, no
Okay.
pressure, but yeah, any topic, let me know. So
Okay, super.
Awesome.
Thanks a
Well,
lot.
thank you.
Yep.
Have a great day.
you
Merry
too.
Christmas to you. Okay.
Merry Christmas. Bye.
Thanks.
Yeah. Bye-bye.